arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back, everyone, to another episode of You and Your Doctor, sponsored by All County Healthcare. You're able to listen to us on 96.9 and 95.3, and you're also able to watch us on amp2.tv. I'm your host, Rayma Phillips, and today we have another very special guest with us today, Dr. Fajolu. How are you doing today, doctor? We are so blessed. Yes, we can hear you all right. How are you doing today?
I'm doing well, thank you. How are you doing?
I am doing very well, thank you. It is just an honor to have you on the show here tonight. We're all very excited.
Oh, thank you. So am I.
That's amazing. Awesome. Okay, so we're just going to jump right into the interview. So can you start by telling our listeners and viewers a little bit about yourself as well as your medical background?
Yes. My name is Nigerian. I'm half Jamaican, half Nigerian. I was born, in America, from New Jersey, also raised in California. As far as my training and all that, I went to residency at Ohio State. Before that, I did medical school at Northwestern in Chicago. And before that, I was an undergrad in college at Yale University. Since then, I have gone on to do a hand fellowship at Beth Israel Deaconess Harvard Medical School's program and a shoulder fellowship at Johns Hopkins. And then recently have moved down to the Palm Beach County area.
Wow, that is a very extensive resume for sure. How do you like the Florida area so far?
I'm liking it very much. Yeah.
I'm very happy.
Yeah.
It's a hard place not to like, I'm not going to lie.
Right. Yeah, definitely.
I actually went to school up in New Haven, so I'm very familiar with the Yale area as well.
Very nice.
Yeah.
Okay. Cool.
Yeah, very, very cool. Small world for sure. So tell us a little bit about what you specialize in when it comes to orthopedics.
Okay. So I specialize, one part of it, I would say hand and wrist surgery. So any kind of fractures of the hand or the wrist, any kind of, if you cut your tendon or cut your nerve, I do nerve repair, tendon repair, some microsurgery where that's concerned. And then if you have arthritis in your thumb or your wrist or your hand or any kind of tendonitis, I treat that, as well as the elbow. And then it comes to the shoulder, I see things like tendonitis, rotator cuff tears, also arthritis of the shoulder. I do shoulder replacement surgery. So I'm kind of an upper extremity surgeon from the shoulder to the fingertips.
Oh, wow. So all the important parts, basically.
Oh. Yeah.
I don't know what I could do if my hand was broken one day. That wouldn't be able to work at all. So very, very important job you have. And for our listeners and viewers watching tonight, Dr. Fajolu's practices at Orthopedic Center of Palm Beach, County. She specializes again in hand, elbow, and shoulder surgeries, and their office is located at 1221 South State Road 7, Suite 200, Wellington, Florida 33414. And you're able to reach them at 561-967-6500. So, Dr. Fajolu, can you go ahead and tell us a little bit about the age of patients that you see on a day-to-day basis over there at your practice?
Yeah, I see patients. I see mostly adult patients. So, and I think of an adult as someone who's skeletally mature. So, 14 to 16 and up, all the way to, adulthood and even elderly patients. So my practice kind of runs a gamut, but majority is adult. Occasionally, I will see a pediatric patient for a hand fracture or things like that. But in general, adult patients is what I see.
Okay.
Yeah.
So what are some of the most common injuries that you see, especially when dealing with the hands?
So as far as injuries, the most common thing I see is probably a fracture in the hand or the wrist, as well, and or a cut to the hand that could have cut a nerve or a tendon. Also, some people can get their fingers jammed in doors or sports injuries as well. Those are mostly the injuries I see in the hand and wrist. We see also conditions, things like carpal tunnel syndrome, trigger fingers, de Quervain's. They also call it mommy thumb if you've had a baby and you have a lot of wrist pain, and any kind of like tendonitis. That's what I usually see as far as conditions. As far as traumatic injuries, it's usually fractures or cuts to the hand. Yeah.
Oh, okay. Do you mind telling us a little bit more about what trigger finger is? I know that's a little bit new to me.
Oh yeah. So trigger finger is pretty common in the hand world, I would say. It's basically a tendonitis of the finger. The tendon gets inflamed. Your tendons in your finger on your palm side run through a series of tunnels, and sometimes the tunnel can get very thick, or the tendon can get thick, and it gets stuck. And we call it a trigger finger because your finger gets stuck in a kind of bent position, and then it can spring open like a trigger when it gets released from that tunnel by you manipulating your own finger. And so it can be very painful for a lot of people.
It definitely
and
sounds
if you can
painful.
imagine, yeah.
Yeah.
So, yeah.
So
we
is
treat that as well.
so is trigger finger associated or similar to carpal tunnel syndrome?
They're a little different because a trigger finger is really a more of a tendon problem, and carpal tunnel is more of a nerve problem. So the carpal tunnel is more when the nerve in your wrist that runs through a tunnel actually gets either gets squeezed too much or gets irritated, and so that's when you have numbness, tingling, burning pain. You may wake up in the middle of the night, your hands numb, you drop things. So that's kind of like carpal tunnel. It's a little different.
That definitely
Yeah.
does not sound either
You can
like
have
fun
both.
at
You
all.
can have both.
Wow.
No. Yeah.
Wow.
Good
It's
question.
so funny because I feel like we often take our hands, our fingers for granted a lot of the times. But when something serious happens, it's like our whole world stops. We're not able to do much afterwards.
That's absolutely true. It's one of the reasons why I went into hand surgery for that exact reason. It's one of the things where you can really help somebody because you don't really think about your hands that much until something devastating happens to them, or chronically you have a lot of hand pain. You can't use your hand the way you want to. So absolutely.
So, do you ever deal with any forms of arthritis in the hands and elbows and wrists as well?
I do. So I treat arthritis in the thumb. One common area is the bottom of your thumb, where your thumb and your hand kind of meet. And so we can do a lot of treatments for that, as far as bracing, injections for steroids, as well as a surgery if it really got really bad. And we also do joint replacement surgery, even in the fingers, if they are
Wow.
really arthritic. Yes, so there are joint replacements for even small fingers and wrists and elbow as well. And then obviously shoulder too. Yeah.
Wow. So you do basically everything. That's amazing.
Oh, yeah. Depending on most things in the upper extremity. Yeah.
So tell me a little bit more about arthritis. I know that is one area that the word can sometimes be scary to so many individuals. So what is arthritis? Like, what does that entail for your patients?
So, arthritis could be in many forms. When we talk about arthritis, usually we're talking about osteoarthritis, which I think about as like wear and tear arthritis. It's almost like if you wear down your brakes or any kind of surface, and all your joints are covered by cartilage, which allows them to move very smoothly and allows them not to be painful. But when that cartilage kind of wears away and gets thinner and thinner, unfortunately, it comes with pain a lot of the time. And usually arthritis, once it starts, it does usually progress. How quickly or how fast, everyone's different. But in upper extremity, thumb arthritis is very common. Shoulder arthritis is also common. Elbow arthritis is less common, but we see that as well. And in the hands, sometimes it can involve all the joints and many fingers, not just at one time. And so
Wow.
we treat that with usually therapy, sometimes injections, medications, as well as surgery.
Wow. Wow.
But we reserve surgery for when it's really, really bad. Most of the time, sometimes you can if it's mild, sometimes injections and some other treatments are fine. Sometimes you do need surgery, and when you do need it, it can be very, very beneficial.
That definitely makes a lot of sense. I know a lot of people suffer from arthritis, and I can't imagine how uncomfortable and painful that can be. So, again, what you're doing is so important, so vital to the community.
Oh, thank you. Thank you. It's
So,
much
I want to
appreciated.
make sure I am pronouncing this right, but what is the difference between rheumatoid arthritis and then osteoporosis?
So rheumatoid arthritis is a different kind of arthritis where it's an autoimmune disease really. So your own cells are not recognizing your other cells and attacking your joints, and so that can be also very debilitating and very painful. Different cause of arthritis, and they kind of look a little different on X-ray. Um, but a rheumatologist who's a different doctor than me, they've come a long way as far as the medications that you can take for rheumatoid arthritis. So if somebody comes in with me and they're newly diagnosed and they haven't had a rheumatologist, I usually will plug them in or try to with a rheumatologist because they can help manage some medications that you may not even need a surgery if that's the side you fall into. That's different than osteoarthritis. Um, so um, so that but again, if it does progress, enough with rheumatoid arthritis, you may also need other treatments like injections, medications, and last resort would be surgery. Yeah.
Again,
And then you
very.
asked about osteoporosis. Sorry.
No, 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 continue. I didn't hear the last part that you said.
Oh yeah. So that's really kind of the difference between the two. And it's kind of, people can have rheumatoid arthritis in one joint and osteoarthritis in another. So they can come in kind of mixed forms, but usually it's kind of one or the other for a particular joint.
Well, that is definitely extremely interesting. And I thank you for talking about the matter because, again, I know that is one topic that a lot of people do not always necessarily fully understand and will freak out when they hear, oh, you have arthritis. So thank you so much
Yeah,
for clarifying on that matter for sure.
no problem. No problem.
So I'm going to switch directions of our interview a little bit. Can you go ahead and tell us a little bit about your day to day experience within your practice?
Yes. So my main practice, or my main office in the practice is at Wellington, but I also go to the JFK office as well. And we have doctors throughout the whole orthopedic spectrum. So I predominantly treat upper extremity. I do take some general patients here and there, other extremities, but mostly upper extremity. I'm usually in the office um, on average about 3 to 4 days a week. So that's
Wow.
seeing patients coming in who've gone to maybe they've gone to the hospital for emergent care and they come and see me a couple of days later. Maybe they come in because they've had hand pain for 2 months and they just need to see somebody. Or so I see both acute injuries and kind of chronic pain that's been going on for anywhere for a day to years in the office. And then I have surgery days where I do surgery that averages about 2.5 or so days per week. So depending on the schedule.
Oh, wow. And how much training do you have to do within your medical school training in order to become an orthopedic specialist for what you do?
Yeah, it's a great question. So I have, so So usually it's 4 years of college, and then 4 years of medical school. And then that's followed by, for orthopedics, 5 years of orthopedic surgery residency. And then depending on what you want to do, if you want to do hand surgery, like what I do, or joint surgery or spine, then you do an additional year of training on top of the residency for your fellowship.
Wow.
So
Wow,
that's
that
kind of
that is definitely quite a bit of training that you have to do. But I was asking because there are so many nerves, so many tendons and muscles within the hands. Just think about what we're able to do with our hands on a daily basis that we never really think about. So when they said that an orthopedic hand surgeon is coming in, I thought that was very interesting because of how meticulous you have to be throughout your day and throughout your work.
That is true. Yeah, they're very small nerves and tendons, and everything's intertwined in many ways. So knowing the anatomy, and that's partly why the training is as it is. But yeah, it's specialized, and yeah.
Well, I'm definitely going to give you a round of applause for that because that is definitely no easy feat. So, and I'm very thankful to have someone like you doing what you do, especially in this area.
Oh, I appreciate that.
You're very, very welcome. And so
Honored.
moving forward, so talking a little bit more about your practice, would patients need a prior referral before coming in to see you?
Not necessarily. If they have, I think it's they have like a PPO insurance, they can just see specialists. They can just call directly to our office, and we can get them in. If they have an HMO, they have to go through their primary care doctor. But most of the time, they can just call, and we'll see them.
Oh, that definitely makes the process a lot easier for sure. So real fast, we're going to cut to a quick commercial break, and we will be
Okay.
right back in a few minutes.
Okay, sounds good.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, sponsored by All County Healthcare. We are here with Dr. Fajolu, and she is a board-certified orthopedic surgeon who practices out of Orthopedic Center of Palm Beach County. She specializes in hand, elbow, and shoulder surgeries. Their practice is located in Wellington at 1221 South State Road 7, Suite 200, Wellington, Florida. And you're able to reach them at 561-967-6500. Welcome back. How are you?
Doing well, thank you. How are you doing?
I know we haven't talked to each other in so long.
I know.
So moving forward, I always like to ask this question because I feel like I can get some very interesting answers. But what were some of the main reasons why you decided to go into medicine?
Oh, that's a great question. I decided to do orthopedics kind of throughout medical school. But initially, I wanted to go into medicine to do probably pediatrics. I've always liked kids. I was interested maybe in like neonatology, but when I was doing medical school, I really gravitated to more towards surgical specialties. I like using my hand. I like fixing things in general, and I've always liked physics. And so I kind of gravitated more towards surgery, between general surgery, orthopedics, and neurosurgery. And then, doing my rotations, because during med school you're exposed to all different specialties, and I just fell in love with hand surgery and orthopedics, and so that's kind of how I segued into the specialty. But initially, it was to do pediatrics. Um, yeah, so
Wow,
kind of.
wow. That's amazing. I always like to ask this question. Both of my parents are physicians, and
Oh,
when I
okay.
ask them, it's always very interesting because it's not always what you grew up thinking that you're going to end up going into.
Right, right, absolutely.
So moving forward, I just want to, start to ask some more general questions. So when it comes to our hands, our elbow, and our shoulders and things like that, I work as a physical personal trainer. Sorry,
Okay.
and I know that movement is just so critical to keeping up our bodies and keeping up the health to our bodies. Would you say that there are some chronic diseases within our hands, elbows, shoulders, or some things that you see on a daily basis that are preventable?
That's a good question. I would say yes. I mean, there are some things such as if you were to jam your finger, let's just say, and you stop moving it because it hurt for 3 weeks or longer, you could end up with chronic stiffness, other deformities, contractures. So there's definitely something, like you mentioned, to keeping things moving, within reason and within, if you have an actual fracture, it's different, or tendon tear or ligament tear, that's different. But not moving something can cause contraction in the hand and the elbow, can cause a frozen shoulder. And literally it's called a frozen shoulder. So there are many
Wow.
things that could happen to your extremities, both lower and upper, by not moving and not staying mobile, for sure.
Absolutely. I've worked with patients or clients in the past that had shoulder injuries is probably the most common one that I see who end up only having mobility up to a 45 or 50-degree angle
Yeah,
because they don't end up, moving or taking their physical therapy seriously after their surgery. And,
yeah,
I definitely love talking to people in your field because it helps to shed a light on how important these parts of our bodies are. Because I know, when we break a finger, we really don't think twice about it. But if we take 2 weeks to
right.
go and get seen and get it fixed, we can lead to a lot more chronic issues that are definitely not fun, to say the least, to go through.
Yeah, yeah, definitely. And so I definitely am a proponent for, getting things evaluated if there's any concern, and making sure there's no fracture, there's nothing, very serious. And then that doctor can guide you as kind of the right path, whether it's therapy, whether it's doing exercise at home, whether it's surgery. But you're never kind of alone in this situation. There are always people around available.
Again, absolutely beautiful what you're doing because, as I mentioned before, it is just so important to upkeep our bodies in every possible way in every possible area.
Yes, definitely, definitely. So, hey,
So
what you're
is
doing too.
exactly, keeping up our body and maintaining that balance. I tell my clients every single day that it's one of the most important things that you have to do. You don't have to be a crazy marathon runner or a health nut, but having a balanced lifestyle can help you in more ways than you can even imagine.
Absolutely, definitely.
So I'm very interested in your story as well. Being an African American going through the medical system within the United States, what was your experience like?
That's a good question. So my experience, so as far as the percentage of other doctors, and also surgeons and orthopedic surgeons who kind of fit my demographic is very small. And so that was something that, I was a little, worried about, as far as, what kind of environment am I going to be able to be in and train in. You definitely experience that, I think, anywhere you go in America, honestly.
Yeah.
I was lucky, I would say, in that places that I've trained, I've had a lot of support. And I haven't felt, to like a large degree, that against me, though I have seen it in many places, unfortunately. Um, I feel like, where I've been blessed in that I have had supportive mentors, um, across the board, I would say, for myself. Yeah.
Again, is just so beautiful here. Being African American myself, it is always amazing to see just so many young, powerful women within, like you, within the positions that you work in. So, again, I applaud you heavily for what you're doing today.
Thank you, thank you. And I have had a lot of very strong female mentors and male mentors too,
Amazing.
in my path. Yeah.
Amazing. We love to see it.
And
We
African
really, we
American
really,
mentors,
really
I would say,
do.
as well. So I've been positioned well in that sense, but
Good,
it isn't
good.
always easy, and it isn't always, um, you know, the thing you kind of see is, because depending on who you're working with, people have their expectations, and sometimes you have to address those either directly or indirectly. But as far as my mentors and training, I think I've been in a good spot.
I'm really, really, really glad to hear that. So, as the show comes to a close now, are there any last minute remarks you would like to give to our listeners and viewers tonight?
Yeah, I would say, if you are, interested in um, seeing somebody for your shoulder, your hand, or your wrist, I'm always available. I have two other partners in hand and two other in shoulder. So between all of us, there's definitely, in our group, ample opportunity to be seen. Um, I will say that, I love what I do, so I'm happy to see anybody. There's no question that I won't think is a good question, and I like teaching and I like explaining what's going on with patients, so they know how to proceed and they understand their body. Um, and I'm somebody who kind of, although I love to operate, I usually reserve that when patients really need it. So I will always counsel you on many different options, including surgery, so that you can make the most decision that's right for you. So yeah, so that's how I would say. So my approach to medicine. I will add back, based on your last question, that there are some programs that have been in place for minorities and women in orthopedics, which I think have also been helpful for me in my training. So
Well, thank you again so much for coming on to our show tonight. And thank
no,
you.
thank you for having me.
Of course, it is our honor and it's our privilege to have all the doctors on our shows. And I just want to thank you for our listeners and viewers tuning in tonight for another episode of You and Your Doctor. And stay tuned for next Monday at 6:30 p.m. for yet another amazing episode. Have a great night, everyone.